Hi, my name's Joe Conforti, and I'm here to see Dr. Ostad today to get some filler done in my under eyes. I had my upper eyes worked on, and that came out so great, so now I want to get my lower eyes worked on.
Joe came into our office, unfortunately, initially with a skin cancer on his cheek. This was a basal cell carcinoma as a result of sun exposure going back to childhood. He underwent a Mohs micrographic surgery, which is a method that we use to treat skin cancer. It has the highest cure rate, along with the ability to preserve as much normal skin. Therefore, we can really create minimal scarring. He had a phenomenal outcome. His scar is barely noticeable, and I'm so happy that he felt good about that and he's got such beautiful results.
That was really the start, and it was a very easy procedure and it went really well. Then I decided I wanted to do some more things.
He came back and he was inquiring about what he can do with this excess hooding on his upper eyelids. He was always bothered by that, and subsequently he underwent what we call a blepharoplasty, or an upper eye lift.
He walked me through the process, what it would be like, and showed me some before and after pictures of other people, and I was on board 100%. I came in and Dr. Ostad did the surgery. Afterwards you look like you had your eyelids cut, but I went home and I followed procedure and iced it and did everything the doctor told me to and the staff told me to, and I'll tell you, it was, the downtime and the recuperation was minimal. In fact, I had friends come over, they wanted to see, they were excited to see, and they just couldn't believe the work that Dr. Ostad did and the stitching. After I had my upper eyes done, I came in for a follow-up visit with the doctor, and I was talking about my lower eyes. They weren't as bad as the uppers, but I wanted to, talk about it, see what he could do.
Today, Joe comes in to have his under eye hollows treated. He's been bothered by the hollowness along with the wrinkling that he has. We will perform hyaluronic acid filler injection. This is a treatment that takes really roughly around 15 minutes to do. It lasts for approximately a year to a year and a half. And I use what's called a cannula. Cannula is a blunt instrument shaped like a needle. However, it's not sharp. It's quite dull. And the advantage it provides is that it really minimizes bruising.
One of the great things about coming to Dr. Ostad is having started as a dermatology patient and having the Mohs surgery, and then moving on to having some of the more cosmetic stuff done, really has had a major impact on my life. Seeing myself now, well, first of all, knowing that the Mohs is gone and we checked that and I don't have that anymore, but just looking at myself now, and like I said, when I get pictures taken of me and when I look in the mirror, my eyes and my face look completely different. And I really do feel like a different person. And people say it all the time, and even the doctor said it to me, we're gonna do this and people are just gonna say, wow, you look great, did you get your hair cut? Or what did you do? And that's what people say. It's like, no one knows that you had the work done, but you just feel fresher and better and healthier.